Half of the Wel Bodi Tok program. Welcome again. Inside the first half of today Yon program, we review health topics them where we don't present on. We don't try for look at an overview of geriatric care where we look at the old age, and we don't also try for look at wetin we need for understand about drug interaction, especially in hypertension. And same way, so don't try for look at the health hazards of the improper care of the environment and self-care, wey na a key to health and well-being. Now the topic then that way we review quickly before the break. And also wants for use this opportunity again for tell una say registrations they go on. So do you civic right for go and register. And also they use this opportunity for say happy birthday to Reverend Father Lajen George as he celebrates in birthday today, where he will don't be one of my guests. Hello. Good afternoon. This is Radio Maria Salon.
Yes, Mr.
Yes, please.
I just listening you talk. I know we talk that time when you talk of drugs relations.
Okay.
I'm the one that you go over for me, and then me a visually impaired person, meaning I know they see.
Yes, sir.
And then me also a hypertension person.
Okay, sir.
Me aging at 40. Talk for me, please.
All right, sir.
Thank you.
Yes, sir. Thank you very much. That's now we call our live from Bo. We don't follow the program for today. You don't miss out the side we talk about drug interaction, understanding drug interaction, especially with hypertension. We now a presentation we farm Esther Bintu Fode become and do now the studio on the 7th of August. And me listener out there, don't tell we say he visually impaired and he old 40 years and he hypertensive. Thank you very much for bringing them up, and thank you also for follow the program. And things after the program we go get more time for talk with you, and I go also make you get your number and try for hook you up with the pharmacist Esther Bintu Fode, so that he go explain to you in detail, or he go explain to you in depth of waiting and you challenges them as well. We go able for make you understand best, being that the time too short for the other presentations them not just an hour. And with that, I just want make you know say with hypertension, of course we don't say na high blood pressure, and some people it can happen with them, they not get signs and symptoms, they not feel anything, whereas others can know either they aid heart or they say them back or the heart, they get their own sign, or tomango say me eye, as a case may be. But when you go then take your pressure about 3 consecutive times, it still they show high, even though you don't rest, you know, yagba no nothing, is still high, then go tell you for let you get a lifestyle modification. Maybe if they cook too much salt for you, for reduce the salt. If they cook too much oil or palm for you, for me then go reduce some for you, or also try for they do some small exercise, or maybe you not possibly they smoke or some other things, then your lifestyle, your social history gets much. Individuals then get them variation, so it depends on the individual in your history taking. Now they in your advice will be emphasized. And with the drug interaction, at the try for say, in as much as somebody hypertensive, yet other people can be hypertensive and diabetic at the same time. Other people can be diabetic and get peptic ulcer disease at the same time. So if that's the case, then you doctor need for know waiting are you different conditions them, and see how it go blend some of them medicines there, because some medicine not they work with in other company, the other one go get power past the other one. So if you take all two together, you go see say even though they take these two medicine together, they say the medicine not they work because one they overshadow the other one. So you find out say at times where it goes, where I might tell you say, okay, if you take this particular and wait after some time, then you take this. or no, this other particular medicine not take away you angry, or this particular one you go take where you not eat it. You get the different protocols for medicines. And so with hypertension, you get this drug interaction, especially in hypertension. So I will try for say with hypertension, so if you get different classes of drugs then according to the pharmacy system where the treatment fall on. So some person can fall under one, some person can fall under two. So it depends. But if somebody can fall under any of them class here, then it be say it diabetic or it get peptic ulcer disease, then the advice come in, the specifics come in for narrow and down, whether not in line with food, whether not in line of the dosage of the drug, whether not in line with the timing of the drug, or which particular drug, then go tell you say with all this one first, or not take this together, take this and wait, as the case may be. So me listener out there in Bo, I hope say this don't help a little bit. As I say, the Radio Maria line. Now, as you don't call, you go try I go try for get your number from there and then hook you up with a pharmacist, and then you get a better understanding in as much as you visually impaired for make you go know other than you for the help you for read, and for me you able for understand which particular drug you dey which use at what time. Yeah. So I hope say I try for answer the question or give headway as you miss out. Listeners and viewers, the second half of the program, I say we go talk on communication. In Wel Bodi business, communication very important. We get some information where immediate. If you give now, it be of benefit. But if you late for giving information, then the result could be late. So do here with the big. There are times where patients sick, if they go to hospital, yes, it can be an emergency that 911 they go. But when you go with if opportunity say that I want to go, explain the right thing. So when you explain the right thing, then go able for give the right treatment. Like for example, with women, them the young girls, maybe sometimes with a menstrual cycle, you not don't see menses. Then because here in mama go, they talk say, yes, I don't see my menses. Then maybe because she not talk the correct thing, they don't go give a particular drug where because of pregnancy at that time the pregnancy go get issue, you don't go take that medicine, then it cause problem. So there with communication, that will be realistic. And there the healthcare workers too with communication. There are some people or some conditions or some things that we need for know they're very, very sensitive. So even the health workers then plenty, it can be beneficial that some of the health workers then reduce and then allow confidentiality for the patient and the person where they attend to. And so it go open up, it go verbalize, then go ask questions, it go open up and talk freely. But if somebody else did it, like it can be something. And also I want to send out this message as well to the parents them and all. Mostly when we go to pick it up, one day they pauper. But once they are teenagers, as the case may be, there are certain things they go be free for Tokam to use some of them, whereas others not go be free. Then go prefer for Tokam to the healthcare worker. So in as much as that's the case, we need for help and get privacy and confidentiality, but it left to the healthcare worker for explain to the parents for me able for understand. Yeah. Then also the manner how at times we go talk, because some go don't come is so desperate that they in need of something, he go shout, he go holla, he go this, we can understand that because when people then stress and get different way for react. But however, we they talk there, where we they go at the Wel Bodi workplace, let we calm down and see say we able for talk well and pass on with information. As I don't say in the first half of the program, we don't talk on emergency triage. There are times where you they come, it can be say you don't come early. So if the healthcare worker don't educate the patients them for the day say, well, do ya una don come today, we know say some of una don come very early, but it can be say somebody come with an emergency. When somebody come with emergency, wey mean say if somebody carry dey bleed, or somebody carry name blow fine, or somebody carry you see same body blue, or somebody come e just left body and all do ya with the baby, go get for attend to that person first here, because if you sef go wan do that. So that's communication. So you don already create the platform. They don't know say na protocol that if it happen to them sef, dem go wan let them give them the priority. So we need for the communicate to them often and often again. So where any other person can you tell am wetin na the protocol, so you no talk say this hospital and can dey get why can they not even talk to me from today me don can na this the normal then they attend to. We need for make them understand. Then that take me to communication so broad that I'm not able to talk all. So that take me to birth preparedness, and the midwives they get so much for the with birth preparedness, and we don't get so much challenge. And with communication, I forget now Sylvester, the one of the volunteer then Radio Maria be helped me for talk on that study. Then we come to the birth preparedness, where the midwife na antenatal clinic na King Haman, we na nursing officer Geneva Soiree, na I be go interview and come that day we do the presentation day. And on the birth preparedness we be talk wetin the belle woman then self need for prepare. Belle woman they can come, then they can clinic, then time they reach then go tell them waiting for do say you get for can born, where you they born, you forget you tulapa, you forget the cap for the pikin, the socks for the pikin, you forget in clothes. You say for couch you own clean clothes, and they tell them all them thing they are. So but it can rather unfortunate where some woman they come nothing you know they come with. Remember say mostly when they don't give expected date of delivery, either you born, some people either you born 1 week before time or after. So if you they born, I know they talking about preterm, the one that we get premature baby they were born until even 1 or 2 months before the time. You were born 1 week before. You don't already know say so months now get for work. You back for the already. You not traveler now. You don't say at any time you dey travel. So let the bag ready with all length here where they tell you now hospital. So as time reach, you just the extra bag and go. You not get for begin fen again. Where this. Remember where that picking the bond that 10 day. You don't need feed the bottle. Now that lapa day you need then get for whip this picking body. Because it don't come outside be so comfortable for I don't can other side, don't pass inside water. Then for can whipping body fine, keep that picking warm. The picking they lost its 9 foot and head. Then for get socks, then for get cap. So dear, you will get the lady expect for born, ready you bag. So when time reach for born, you don't say just the ace that bag go. You not go begin go fen again. Yeah, and buy cotton lapa, not buy then lapa the way na nylon, buy cotton lapa. And then they tell you where you get this belly, then they forgive you maculates for tetanus. Then they forgive you. And after you born again, you get for continue for take them, because again in number of doses the way you for take where you don't take them for life. Then go they can the clinic where they give you the time, and if you want then give you the time, then time time not reach, you feel sick, you not feel okay, come. Because when you come, then go no waiting for do. Because some person go get belle, he get sickle cell. Some man go get belle, he get diabetes. Or some man upon belle na they the diabetes, then can't take note of her. Because the belle don't grow past the number of months. You go see say we born the pikin can big. So you get all that one day. So dear, where you they go clinic. Anything where then they tell you, listen to her. When they talk to you now during health talk, tell you say now this for it, now this for it, now this for it. Ask question. May you learn, may you understand, may you see if you na tradition. Don't tell you say no, I not for eat this. If I eat crab, the pikin they water. If I eat this, the pikin go this. Then I go clarify for you say no, you pikin no go water. Crab get so and so nutrients. Benny get so and so nutrients. Okra go fine for the pikin where you eat am. Wetin you eat, tomato na ain't go pass for me the pikin go get and let the pikin get enough blood. Because time they reach na the belly, the pikin no want know if you get blood or you not get blood. The pikin they get a all thing for himself, because get for common ado for can live in your life. So dear, bad preparedness. Know the kind clothes where they wear. free one, let the pikin self able move, let you self able move. But we can see some belle woman and then close them so tight span, they wear tight trousers, they walk away high heel as I don't know. You get boku temp for bluff. So dear, that 1 to 4 months, where sometimes the belly don't show, some person have from 5 months they go. That few months they now, they are beer. So you still get designer clothes there where he go where they bluff with span. The person not go even no self say you get belly pass some person where the hormone they really work now in face, they really see say this in face all don't change. But some person not they even waiting now. So dear, bad preparedness, prepare well for the bath. Identify your bath companion. Wait time reach for go born. Here Uda get for go. Now here in the man, now here your sister, now here your mama, get a bath companion. Because the belly, all man they pray where you born, let the belly, let the outcome fine. But some belly, last minute, other thing go happen. Then go tell you say they need blood. Then go tell you say if I go for operation. Then go tell you say this belly, the time where if I born, it don't pass. So they carry go to theater. So that make you need bath companion. So if something happen, you get down the way go dey near you. You bath companion, they support you. You go rub you back, they go talk to you. You hear and go they share. You go tell a certain thing, or sometimes you get language barrier. You go they talk with her. You go be an interpreter. So bath companion very very important. So when you know say you time they reach for born, identify you bath companion. Identify usa you want go born, and when they identify usa you want go born, make sure say the book where you get where them be done they write all thing for you for take her along then you passport any side you they go you for day with that book, because anything can happen. Sometimes you get malaria, then the pikin you can't born them before time, because one other cause we can make some woman and they get premature delivery, so now infection, malaria. So do ya bad preparedness where they go clinic, then give that 3 tablets, say take them, do ya with the bake now for drink them for let the malaria no ambog you, or even ambog the pikin for let you not born before 10. If then give you the folic acid, say take them now for take them, so that you go able for help this pikin let you not born and tuma it can get problem when because of just that small tablet you not take her, it can get cleft palate where you all can open panam. So they are with the big anything where then give where you don't understand, ask question, communicate, ask question, and you go get answer. Yeah. So if you get belly, now for eat well, now for sleep well, now for wear comfortable clothes, now for wear low footwear and comfortable one, now for go clinic. You get any problem, now for go clinic. Identify usa you want go born. Identify you bath companion. Prepare the bag, usai all thing for you and the pikin. Yeah. And then the few last one way I will talk about, maybe 1 or 2 before time they catch me as usual. Now Dr. Adetola Ahmed, we na a neonatologist, where they work na UNICEF. If you can help me talk one day on the ideal care for the newborn at the hospital and at home. So as I say, bad preparedness, you don't already born this pikin in a hospital, then get for take care of them. The nurse then go look after them. They go then 24 hours for me then observe una and see say if the pikin okay, then una go na host. But if the pikin not okay, then they go admit the pikin a special ward, we then call the special care baby unit, when at the SCBU. And the special care baby unit, it gets special cases when they look at pikin wey premature, when they born and before 10. Pikin when a twin, because at times sometimes a day the one they born in weight this low, the other one in own weight okay, then get for admit her. Or pikin way too big for in weight, you they see and say even past 4 kg, then get for admit them. Or picky where them born and not cry, then get for admit them. Or picky where them born and get jaundice in yala, or you see and in body. So you get then thing there, or any of the other things about this now key things them where can happen where they can admit. Then a us. Sometimes a us the pikin not agree for sock. You need for carry it in a hospital. Or the pikin be the sock fine. Then you see no man they left body, they sleep. You they get one body, you get for carry it in a hospital. No wait till let water pass flower. All the SCBU them where you they care you pikin go. Treatment na free. You get an a Oladurin, you get an a Rokupa, you get an a King Haman Road, yeah, 34 day, Lumley day. Although at times if they self not get paid, as the case may be, then they send to the other hospital, yeah, King, then they send to King Haman, or they send to olajurin. So dear, if the pikin dey 0 to 28 days, this one wey dey on a pikin wey dey 0 to 28 days, wey call neonate, wey old 1 month or wey dey below 1 month, any of them thing there, then for calm. If the pikin then na host, let mama dey wash him hand fine for gear and bobby. The pikin themself, they know wetin na cleanliness. If the mama come for gear and bobby, the mama no wash him or the mama in smell different, the pikin no dey suck. Because one thing for say the pikin dey know na mama in body smell. So if you got some kind smell for that day, the pikin no go gree for suck. And also no wait say the pikin cry. The pikin then get different cues where then they show where you go no say they want for suck, not to pass and cry. For crying at the last resort. You see pikin begin put on a mouth, it begin they turn him out, so it get in different way. Then you know say that pikin they don't they angry or intent don't reach for it, not to pass it cry. When you see cry, then at the last resort. No wait say then they cry now either angry or he want sleep or he don't soak. So do ya at the big, yeah. So let we do that one day. Then the pikin then na us we dey listen to ya. Let we advise them make them not bandage the pikin then dodo, yeah. The dodo for left out, so it go well. That dodo they wear by breeze, yeah. The breeze they dry and fine, and the cleaner it dey over the pampers, you know, they inside the pampers. Why they talk so? Because boko of them young baby there, their mama they don't can admit with them. Where you ask them, they say na them granny them bandage them. Say breeze go na the pikin belle, or them put tabaka leaf, or them put never die. You know they put nothing there. Where you born in hospital, then they get chlorhexidine, where then they apply the. And this then the air dryer, they left their cord day out. Few days after it they dry for them for himself. So do ya at the big. Because now one of the kids in and the way picking and kid don't go na house where the mama then they carry them for now hospital. Neonatal sepsis infection. Where then they carry the picking, and one of the commonest infection are the one where they unblock that then dodo. The way then kid don't go put her inside pampers, or they don't go bandage them, or they don't go put tabaka leaf there, or they don't go put never die there. Or you see the pikin or the grief for suck, or the pikin you see say in body the yala or in eye the yala. Do ya that we take care of this. So family there, this na the end of today your review. Me we bring the program come to you. Me na Gifty Masakoy. Well Bodi Talk na the program where they come to you every Sunday 4 to 5 Sunday from Radio Maria Salon, the Christian Voice. Now you host na free to you go get to in a 90.9, Makeni 101.3, Bo 91.7, and Kenema 90.7. Thank you to viewers and listeners. Don't forget for go register. Don't forget for look after you else. And happy Sunday to una all. Till next week. I tell una tata and left una in the name of the Father and of the Son and of the Holy Spirit. Amen.